Back pain is one of the most complex conditions to treat, so patients will try everything to get relief, from drugs to surgery. Now millions are turning to a popular shot called epidural steroid injections. These shots get injected into a very vulnerable area of your spine for pain relief. But do they really work? And are they safe? I enlisted top investigative reporter Elizabeth Leamy to go undercover to find out. This is the first of a series of exclusive investigations the show's going to be doing to help protect you. Elizabeth,
yes.
I love this topic because I think there's so much misinformation about it. Why do you think epidural steroid injections are so popular? Why are people craving them?
Well, they are the #1 procedure doctors do for low back pain, and I think the reason patients go for it is that they're marketed as a less invasive alternative to full-on back surgery. But what I found is that no matter if you're poking knives or needles around that delicate area, there are serious risks.
So Elizabeth spent the last 6 weeks investigating these shots, as well as what patients are told before they get them. Here's what happened when she went undercover.
Doctors perform epidural steroid injections 9 million times a year on patients desperately seeking relief for their pain. But here's what most people are never told. Epidural steroid injections are not FDA approved. But some back pain clinics tell their patients the opposite, as we documented with our hidden cameras.
What is the medication called?
Depo-Medrol.
Depo-Medrol is FDA approved then?
Yes.
For these epidural
Right.
shots?
It's specifically designed for these injections.
We also called more than 20 other pain clinics posing as patients, and all but one insisted epidural steroid injections are FDA approved.
So it is FDA approved, yes.
For epidural injections. Okay.
But that's wrong. The steroids used are approved for your muscles and joints, but the FDA has never said it's safe to inject them into your spine. And yet doctors are allowed to do it. It's called off-label use, and it's perfectly legal. Medicare covers the injections, and famously stingy insurance companies even pay for many of them. But could this back pain procedure be dangerous, even deadly?
It's just incredible. Unbelievable.
Patient advocate Dennis Capolongo's group wants the FDA to limit or even ban epidural steroid injections.
People are not being told the truth. They're being literally taken into these injection mills and injected on a daily basis. Collateral damage.
So what's the possible danger? The potent chemical cocktail is supposed to go just outside your spinal cord. But if a doctor accidentally injects it inside instead, this can cause an excruciating, incurable condition called arachnoiditis, documented in these pain diaries.
I can't express how painful it is.
I think that maybe suicide isn't such a bad option.
Another documented risk, paralysis.
A woman from Deerfield Beach has been awarded tens of millions of dollars after being left paralyzed.
A routine procedure called an epidural left her in a condition she never could have imagined.
Worse yet, if a doctor misfires an epidural steroid injection into an artery, that could cause a fatal stroke. Doctors who perform the injections say publicly that catastrophic outcomes are rare. But when researchers surveyed doctors anonymously about upper spine injections, 27% knew of patients who'd had dangerous complications, and 4% knew of patients who had died. With potential dangers that severe, we want to know, do doctors adequately warn patients? Armed with our hidden cameras, time to go undercover. We visited 3 back pain clinics and no one mentioned risks until we asked.
But you don't consider it risky?
There's always some risk, but the risk is negligible.
The risk is similar to if you wanted to walk from here over to the McDonald's, and the likelihood you're going to get hit by a car that day.
2 out of the 3 clinics said one of their steroids of choice is called Kenalog.
We use Kenalog.
Even though every vial of Kenalog says not for epidural use due to reports of serious medical events, including death. The manufacturers who make the steroids most often used for these injections told us they don't condone or recommend epidural use. So why do doctors perform 9 million epidural steroid injections a year? critics point out they can earn $2,000 for each 10-minute procedure.
I do about 4,000 procedures a year times 15 years, so maybe 40,000.
And that can bring big money. Even more disturbing, some doctors spend just one weekend learning the procedure at courses that advertise epidural steroid injections as lucrative options that create dramatic earnings.
It's an excellent course, and of course the business aspect of it, which is the part that I'm paying a lot of attention to.
Which makes you wonder, could epidural steroid injections for back pain hurt more than they help?
Elizabeth, I'm flabbergasted watching that investigation. So let me explain, if I can, to everybody why this is a big issue for me, why these shots aren't as safe, perhaps, as folks are making you believe. The idea is a simple one. Here you have the spinal column. You're obviously looking this way, so this is the back of those little bony processes you feel in the back if you were to touch there, and you have little nerves coming off. The thought is to take something, a chemical that would be a painkiller, and to put it in just the right spot so you can sort of break the spasm and the cascade of pain caused by nerves that have been irritated. That's the concept, right? Makes a lot of sense. Everyone would think you could do this elegantly. So how would a doctor truly do this? I took the same model and I just rebuilt it a little larger so you can see what it looks like. You all appreciate this. So what you do, you lie on your stomach. The doctor takes the needle. He goes through the area between these little bones in the back of your spine. Of course, it's a long needle. Goes into an area where you finally puncture beneath the skin and the tissue's nearby. But this is important. You'll notice I'm in a very special place now. I'm inside the skin, underneath where the bones are, inside the bone, but I'm not through this final little layer. Right? This is called the dura. This protects the spinal cord, which is all here. So your spinal cord, this layer, protective layer, and this needle has to be outside of those. If done correctly, it does this. You got all this stuff coming out and it's displaying where it needs to go, and everyone's happy. However, if the doctor goes just a little too deep, and that's not much, my friends, all of a sudden that goop, it gets on your spine. And it crumples those spinal nerves. All these things get crunched up together, and they begin to collapse down. That causes that shriveling that you saw in that video where the nerves have been damaged. It can even lead to paralysis. So I want to bring in rehab and pain researcher Dr. Jana Friedli, who has studied the effects of these epidural steroid shots. Dr. Friedli, are these shots as dangerous as this investigation appears to reveal?
Absolutely they are. In fact, we have new data at UW that suggests that they are even riskier than what's reported. So what we know is that these injections are riskier when they're performed by physicians who aren't well trained in safe techniques and who aren't cautious in their use.
And do they really work? I mean, how effective are they?
Most patients who get these injections are not going to improve with the injections. So what we know is that they are effective for short-term pain relief for people who have herniated discs with pinched nerves that cause radiating pain from the back down into the leg. But 75% of the people who get these injections don't have that condition, so they aren't likely to benefit.
Let me bring in Dr. Paul Lynch, who's performed about 5,000 of these injections, and that you believe that they're safe and effective. You just saw the investigation and some of this commentary. I'd love to hear your thoughts on this.
Yeah, I appreciate it, Dr. Oz. I think it's so important for your viewers and the people in the audience here today to understand a balanced approach to this, that there certainly are risks and we need to be aware, and it's so important that your doctor talks to you about the risks and benefit of any medical procedure you're thinking about. But at the same time, the thing that I think you realize is that anytime you go to see a physician, we're always balancing the risks and benefits of a possible alternative for you.
Dr. Lynch, is even one paralyzed patient worth it if we're not getting the benefits that we think we should be getting?
If you look at the data here, what's the alternative? We could put them on an opioid, a painkiller, a powerful pain medicine, but we know that that kills about 1 in 500 people who take pain pills. And that's not even a close assessment in my mind.
I'm more concerned that it's a palliative approach, that we're not getting the long-term benefits that I expected for the kinds of risks that we're talking about.
It's a great point, and we talk to patients about this all the time. Now, what I tell patients is if we can get you better even for 2 or 3 months and get you back into healthy life choices, physical therapy, maybe core strengthening, maybe weight loss and an exercise program, then that's a good thing for the patient, especially at this important crossroad.
So Sharon is joining us. She actually got some of these shots, and she believes that it helped her with her back pain. So, Sharon, after hearing the presentation today and the concerns that have been raised, would you still have gotten these epidural steroid shots?
Yes, because I was in such excruciating pain, Dr. Oz, that the other recommendations for relief of the lower back pain, I was not able to participate in.
Were you aware of the risks that were presented today before you had your own injection?
I was aware. It took me about 6 months to decide to actually do it. But the quality of my life, and I was unfunctionable. I couldn't pick up my children. I couldn't bend over to do simple things.
So for the many folks watching now who are in a lot of pain, and despite the concernings and misgivings that I think we've shared, still want to get an epidural steroid injection, what should they be looking for?
All right, well, 3 tips gleaned from talking with dozens of doctors. First of all, time. Give yourself at least 6 weeks of rest and physical therapy, and only consider an injection if you've seen 0 progress from those. Second, know your diagnosis. Know you're one of those people with a pinched nerve that actually will respond to this treatment. Usually it means there's pain radiating down your leg, and it's really the leg pain that responds, if I'm not mistaken. And finally, select your doctor carefully. Choose somebody board certified in a relevant specialty, lots of experience doing these, and avoid doctors who automatically say you need an entire series of these. Instead, choose somebody who says, let's just try one and see how we do.
So let me offer my bottom line thoughts, because I've gone through this process quite a bit. I agree with the 3 major pain societies that say these injections should only be used for a small set of patients with pain radiating towards their legs, as Elizabeth mentioned. That's not the majority of people who suffer from back pain. My biggest concern is that the results are short-term for the most part, and this procedure carries with it a lot of risk for that limited relief. So pick the procedure carefully.